Bismillahirrahmanirrahim. Don't focus on how much you eat, focus on what you eat. Assalamu alaikum. Today, the topic of my presentation is a nutritional problem under kind supervision of Professor Dr. Saira Afzal. The learning outline of my presentation is introduction, WHO facts about malnutrition, cases of malnutrition, prevention, recent updates, and at the end, there is an MCQ session. In the end of this presentation, participants will be able to describe about malnutrition, its prevention, and recent updates. Basically, there are three phases of malnutrition: stunting, wasting, and overweight. 149 million children under 5 are affected by stunting, 45 million children under 5 are affected by wasting, and 39 million children under 5 are affected by overweight. The term malnutrition means both undernutrition and overnutrition. Undernutrition, which include wasting, low weight for height, stunting, low height for age, and underweight, low weight for age. Micronutrient related malnutrition, which include micronutrient deficiencies or a micronutrient excess. Overweight, obesity, and diet-related non-communicable diseases such as heart disease, stroke, diabetes, and some cancers. Malnutrition in all its forms include undernutrition, inadequate vitamin or minerals, overweight, obesity, and resulting diet-related non-communicable diseases. 1.9 billion adults are overweight or obese, while 462 million are underweight. Globally, in 2021, 49 million children under 5 were estimated to be stunted, 45 million were estimated to be wasted, and 38.9 million were overweight or obese. Around 45% of deaths among children under 5 years of age are linked to undernutrition. These mostly occur in low and middle income countries. At the same time, in these countries, rate of childhood overweight and obesity are rising. The developmental, economic, social, and medical impact of the global burden of malnutrition are serious and lasting for individuals and their families, for communities, and for countries. Which people are at the risk of malnutrition? Having a long-term health condition that affect appetite, weight, or how well nutrients are absorbed by the gut, such as Crohn's disease, problem of swallowing, socially isolated, have limited mobility or low income, need extra energy, such as people with cystic fibrosis are recovering from a serious injury or burn, and those with tremors. People who are 65 years and over particularly are risk, and weight loss is not an inevitable result of old age. There are many disorders which are due to malnutrition, like protein energy malnutrition. In protein energy malnutrition, there are two types, kwashiorkor and marasmus. Undernutrition of vitamins and minerals, it also leads to different types of diseases and obesity. There are 10 differences between these two protein energy malnutrition, kwashiorkor and marasmus. Kwashiorkor develop in children whose diet are deficient of protein, and marasmus due to deficiency of protein and calories. It occurs in children between 6 months and 3 years of age. Kwashiorkor and marasmus is common in children of 1 year of age. In a kwashiorkor, subcutaneous fat is preserved, but in marasmus it is not preserved. Edema is present, and edema is absent in marasmus. In large fatty liver and in marasmus there is no fatty liver. Ribs are not very prominent, but ribs are prominent in marasmus. The children of kwashiorkor are lethargic, and the children of marasmus are alert and irritable. Muscle wasting mild or absent. There is severe muscle wasting in marasmus. Poor appetite, voracious feeder. The person suffering from kwashiorkor needs adequate amount of protein, and the person suffering from marasmus needs adequate amount of protein, fats, and carbohydrates. Marasmic kwashiorkor, a severely malnourished child with feature of both. The feature of kwashiorkor are severe edema of feet and legs, also hand, lower arms, abdomen, and face. Also, there is a pale skin, hair, and the child is unhappy. There are also signs of marasmus, wasting of the muscle of upper arm, shoulder, chest, so that you can see the ribs. There are many diseases which are due to deficiencies of vitamins and minerals. Like in a calcium deficient, people may suffering from rickets. In iodine deficiency leads to goiter. Iron deficiency leads to anemia, and due to zinc deficiency, there is a problem of growth retardation. And in the vitamin deficiency, thiamine leads to beriberi. In a niacin, there is a disease which is known as pellagra, and vitamin C leads to a scurvy, and again vitamin D deficiency leads to a rickets. Prevalent form of malnutrition in developed countries. In the developed countries, the overweight problem is very much big. BMI when exceed more than 40 is a grade 3 obesity, which is also known as morbid obesity, and BMI when more than 50, then it is known as super obesity. Women have higher rate of obesity. Women's BMI increased by 1 kg per pregnancy. Relationship between alcohol consumption and obesity positive for man and negative for women. Cutoff value for obesity in epidemiological studies plus 2 SD for median weight for height. In a layman terms, body weight in excess of 10% of expected weight. There are 6 P's which are important in a malnutrition production. About half of people in developing countries do not have an adequate food supply. Preservation, 25% of gain are lost due to bad post-harvest handling, spoilage, and pest infestation. About 50% of easily perishable fruits and vegetables are not consumed. There is a larger amount of population density distribution and urban migration and nutrition, infections and nudism, poverty. Root cause of malnutrition is income inequality, household food distribution. Politics, government policies can foster malnutrition directly by how food is subsidized and distributed. Indirectly, civil unrest and natural disaster affect market availability and cost of foods. There are many symptoms of malnutrition. Unintentional weight loss, losing 5 to 10% or more of weight over 3 to 6 months is one of the main signs of malnutrition. A low body weight, people with BMI under 18.5 are at risk of malnourished. A lack of interest in eating and drinking, feeling tired all the time, feeling weak, getting ill often and taking a long time to recover. In children, not growing or not putting on weight at the expected rate. uh, Changing in behavior such as being unusually irritable, slow or anxious, low energy level, and tiring more easily than other children. Evidence-based nutritional intervention. There is a need of many nutritional intervention to cover the malnourishment. Maternal micronutrient supplementation with calcium and balanced protein supplement, exclusive breastfeeding for 6 months, continued with appropriate complementary food until at least 2 years of age. Vitamin A supplementation for postpartum women and children under 5. Iron and folate for anemia. Zinc is given for diarrhea and measles after measles episode and burns in children 12 to 60 months of age. Universal salt iodinization, supplementary home or community-based feeding for moderate malnutrition, recognition and management of acute malnutrition. A rough guide how your energy requirement can be spread throughout the day is as follows. A part of a healthy balanced diet, women need an average 2000 calories while man need an average 2500 kilocalories. And breakfast should be 20% of a fifth of your energy intake throughout the day. Lunch should be 30%, about a third of your energy intake, and evening meal also having a 30% 10%, about a third of your energy intake. Drinks and snack, 20%, a fifth of your energy intake. If you eat more of for your breakfast, lunch, or evening meal, you may need to drop a snack later in the day to stay on track. Indicators of malnutrition. Single best parameter for assessment of physical growth is a weight. Weight for height is considered more important than weight alone for the measurement of physical growth. But height is a stable measurement of growth as opposed to a weight, because weight reflects only your present status, but a height also indicates the condition of your health in the past. Below, if your BMI is below 18.5, you are underweight, and 18.5 to 24.9 is a normal or a healthy weight, and above 25 is overweight, and above 30 is fall in the category of obese. And the formula for the calculation of a BMI is weight in kg and height divided by height in meter under power of 2. There are two types of classification for a malnutrition: Bloom's classification and Waterloo classification of malnutrition. If your weight for age is 90 to 110%, then it is a normal, but if it is minus 1 standard deviation 75 to 89%, then it is a first degree of malnutrition, which is in a mild category. And if your weight for age is 60 to 74%, then is a second degree of malnutrition, and below 60 is a third degree severe form of malnutrition. And in a Waterloo classification of malnutrition, more than 2 standard deviation is a normal, and if mean is less than 2 standard deviation, then the classification is stunted. How we prevent from a malnutrition? The best way to prevent malnutrition is to eat a healthy and a balanced diet. You need to eat a variety of fruit from the main food groups, plenty of fruit and vegetable, plenty of starchy foods such as bread, rice, potatoes, and pasta, some milk and dairy foods, some source of protein such as meat, fish, eggs, and bean. Use of modern agriculture technique to increase the agriculture production, proper education to people regarding importance of food, enrichment of food, fortification of food, genetic engineering for the development of new varieties, government projects to provide healthy food to infants and pregnant women. Staple food should available at very cheap rate. Common people should adopt rotation in food. Use of probiotic microorganism in food. Global public health and disease control measures. Treatment for malnutrition depends upon the severity of malnourishment. The first dietary advice is usually to eat fortified foods that are high in calories and protein. Snack between meal is also taken. Have drinks that contain lots of calories. Some people also need support with underlying issues such as limited mobility. If a child is malnourished, their families may need advice and support to address the underlying reason. If these initial dietary changes are not enough, a doctor or a dietitian may also suggest you take extra nutrients in the form of nutritional drinks or supplements. Now it's time for the recent updates. Under 5 years of age, there are four types of malnutrition which are faces the children: stunting, wasting, underweight, or overweight. In Pakistan, 4 out of 10 children under 5 years of age are 40.2% of children are stunted in Pakistan, 70.7% are wasted, and 28.9% are underweight, and 9.5% of children are overweight. Nutritional status of adolescent girls or boys. Almost 21% of boys are underweight and 11.8% females are underweight. 10.2% of girls are overweight and 11.5 are also National Nutrient Survey 2018 show that almost 1 in 8 adolescent girl is underweight. Adolescent boys are more affected than adolescent girls. More adolescent girls are overweight compared to their male peers. Um, Obesity is a public health issue of concern in Pakistan, while 7.7% of adolescent boys and 5.5% of adolescent girls are affected. Women of a reproductive age in Pakistan. Women of reproductive age bear a double burden of malnutrition. 1 in 7 are undernourished, a decline from 18% in 2011 to 14%, while overweight and obesity are increasing. In National Nutrient Survey 2011, 28% were reported to be overweight or obese, while this percentage is rising to 37.8% in 2018. This is a global overview in which stunting has declined steadily since 2000, but faster progress is needed to reach the 2030 target. Wasting persists at alarming rate and overweight will require a reversal in trajectory if the 2030 target is to be achieved. Graph shown that percentage is decline in the stunting from 33% to 22% in 2020. Most children with malnutrition live in Africa and Asia. In 2020, more than half of the children affected by stunting live in Asia and 2 out of 5 live in Africa. More than two-thirds of all children under 5 affected by wasting live in Asia and more than 1/4 live in Africa. Almost half of the children under 5 affected by overweight live in Asia and more than 1/4 live in Africa. This is the report of a UNICEF. Pakistan is facing a chronic nutrition emergency. The national global acute malnutrition rate is nearly 18%, exceeding the internationally agreed emergency threshold of 15%. If urgent action is not taken, this will lead to rising mortality rates among children under 5 years of age. A recent study estimates that child wasting could lead to an 18% increase in young child mortality. And the sector which have a great emphasis is required is the nutrition sector, in which 1.7 million children and women require nutrition sector. In a health sector, almost 463,000 people require access to health services, and in a water sanitation hygiene, about 1.8 million people need wash services, and in education, 1 million students are impacted by a school closure. This is one of the article. Uh, a study is conducted in a Bangladesh in which they can give the optimal nutrition to a different childhood, and nutrition related intervention are given by the government in different cities. Antenatal micronutrient supplementation, energy protein supplementation, exclusive breastfeeding promotion, public provision of complementary foods, vitamin A supplementation, and improved infant and young children feeding. A resource optimized tool can provide important guidance for targeting nutrition investment to achieve greater impact. This is time for an MCQ session. Malnutrition is a leading cause of death under 5 years of age. The World Health Organization recommended zinc supplement for which group of people? Pregnant women, lactating women, children with severe malnutrition or diarrhea, all children in low income areas with high stunting, elderly people with low income.
C.
C is the right answer, children with severe malnutrition or diarrhea. Which of the following is not a recommended type of data to inform whether a patient is diagnosed as malnourished? Gastrointestinal symptom, serum albumin level, BMI, functional capacity of a child, dietary intake.
Alpha.
Beta, serum albumin level. According to Bloom's classification, the child weight for age is -2 standard deviation. In which category of malnutrition is labeled for this child? Normal, mild malnutrition, moderate malnutrition, severe malnutrition, very severe malnutrition.
C.
-2 standard deviation.
D. D.
C. Moderate malnutrition. The immediate measure of assessing acute malnutrition of a child aged between 1 to 5 years in a population effect from a disaster. Height for age, weight for age, weight for height, mid upper arm circumference, skin fold thickness. Immediate measure of assessing.
C.
D. Mid
Delta.
upper arm circumference. 3-month-old child was brought to the OPD with severe loss of subcutaneous fat and muscle wasting. His plasma amino acid ratio was normal, and the most likely diagnosis would be kwashiorkor marasmus, rickets, pellagra, cretinism.
Beta.
Beta marasmus is the right answer. As a medical student, your examiner gives you information about protein, energy, malnutrition. You are asked to identify which is specific for kwashiorkor. Child has no edema. Child appetite is good. Child has diffuse pigmented skin. Child lost subcutaneous fat. Child has diarrhea.
Alpha.
C.
C. Child has diffuse pigmented skin. 4-year-old child presented in OPD with sign of edema in limbs, blonde sparse hair, and dermatosis. The most likely diagnosis is
Alpha.
marasmus, kwashiorkor, cretinism, beriberi, or anemia.
C. D. Cretinism.
Beta kwashiorkor is a right option, which is a stable measurement of growth, which also indicate the status of health in past. Height, weight, BMI, mid upper arm circumference, head circumference.
Alpha.
Height A is the right answer. Protein energy malnutrition correspond to a state where the infant's dietary intake is deficient in carbohydrate and proteins, overall calories and protein, protein and fat, calories and fat, carbohydrates and fat.
Beta.
Beta is the right option, overall calories and protein. 40-year-old woman having weight 68 kg and her height is 1.5. Calculate her BMI 25, 27, 30, 35, 40. Any
Alpha.
guess?
Alpha.
C 30 is the right answer. This is the solution. Weight in kg is 68, height in meter 1.5, raised to power 2. 2.25, 68 divided by 2.25 and 30.2 is the answer. This is the key of my MCQs, and thank you.
Thank you very much. Very nice presentation, Dr. Naila. Especially you have referred to very important report of UNICEF while you are presenting under 5 years.